As you go north, there's a lot of mild seasonal affective disorder, and by mild, a lot of people will describe some irritability, some moodiness, but if it's not significantly impacting upon their functioning, it may be alleviated by something as simple as a routine exercise routine, or by changing diet or activities, or by increasing socialization. But if it's impacting their ability to work effectively, their ability to socialize, if it's impacting their family life, if it's persistent, if it's severe, any of those indicators would be reason to seek treatment. There are two main treatment options for seasonal affective disorder, and one of them is called light therapy, and it's really a pretty interesting and unique story because as we've worked with light therapy over the years, we've discovered that a certain type of light is effective in treatment of SAD, and that is a very bright light, and in fact it's measured, and the measurement is called lux. And we're looking for a light with 10,000 lux. And just to give you a feeling of what that means, a typical night light when you're in your bedroom is about 100 lux. So 10,000 is a very bright light. It's a full spectrum white light, and it's a fluorescent light. It also needs a UV filter because the ultraviolet light can cause harm to the eye. So we administer the light, and it needs to be done in the morning, interestingly. So generally first thing in the morning, and it needs to be administered for at least a half an hour. And it needs to be, the person needs to be close enough to the light within about 12 inches, so it can't be across the room. And also the person doesn't look right into the light because that can cause damage to the eye. So there is some work for the patient involved in this because they have to be regular with it. They have to use it each morning. They'd have to have it for at least a half an hour. And that typically the half hour often works, but sometimes we have to use more than a half an hour. And they would have to be willing to do that each morning. Often it's done during breakfast or when they're reading a paper or something like that in the morning. The other treatment would be typical antidepressant treatment, and it really is a patient preference because they both are about equally effective. The light therapy is particularly effective for seasonal affective disorder, whereas antidepressants are effective for all sorts of depressive illness. And some patients would quite truthfully rather take a pill each day and not have to sit in front of a light. And there are other people that really don't like the idea of taking medication, and they'd be better candidates for the light therapy. We do recommend that if you have a particular pattern that you start the light therapy actually before the disorder kicks in. So that would be if every year the illness starts around October, you might start at the beginning of October, end of September, because the treatment is more effective if you start it before the illness begins. And then we recommend continuing throughout the course of the typical episode, which might be right through the beginning of April. So if somebody has some mild form of seasonal affective disorder and is not necessarily seeking medical attention, the first thing I would suggest for them is to get exposure to light. And so getting out during the daytime, going for a walk, so natural light actually helps with that, and also in the office environment, being close to a window. So the more exposure to light seems to help people with mild seasonal affective disorder. Also, regular exercise seems to help with that as well. There are some other remedies that are not as well, there are some over-the-counter type of remedies that we don't have as much information about, but essentially light exposure, activity, and exercise is what I would recommend for somebody who has the disorder but isn't really feeling that they want to see a physician about it.